All right, good afternoon, everyone. Welcome to the Parkinson's Society Southwestern Ontario's webinar series. Today is entitled Welcome to Living in a COVID World, and we have a very special presenter with us today, that being Dr. Quincy Almeida, who many of you probably know or have definitely heard of. He's a great friend to the Parkinson's Society Southwestern Ontario, and I'm very happy to note is now confirmed as one of our keynote speakers for our 2020 fall conference, which is fantastic. So I'll tell you a little bit about Dr. Almeida. He is the Director of Movement Disorders Research and Rehabilitation Center at Wilfrid Laurier University and is one of the leading authorities in movement science and rehabilitation in Parkinson's disease. He's the creator of one of the only internationally recognized and scientifically validated rehabilitation programs for Parkinson's disease, known as PD-SafeX. His research has been featured in the Toronto Star, the Globe and Mail, on CBC and CTV National News, as well as in Maclean's magazine. Currently, his research is focused on mechanisms underlying motor and memory impairments in Parkinson's disease and other movement and memory-related disorders. His most recent funding is from the Canadian Institute for Health Research and the National Institutes for Health in the United States and the Michael J. Fox Foundation. With recent publications in the journal Lancet Neurology and Neurorehabilitation and Neural Repair, he's won several national and international awards, including the Parkinson's Society of Canada Young Investigators Award, Canada's Polanyi Prize for Physiology and Medicine, the Queen Elizabeth II Diamond Jubilee Medal, and a North American Distinguished Scholar Award from the North American Society for Psychology of Sport and Physical Activity. So ladies and gentlemen, please welcome Dr. Quincy Almeida.
And thank you for that warm introduction. And welcome everybody who's joined. I'm glad you're taking the time to participate today. The intention with this session is to sort of, I'm hoping to have more of a discussion than actually a presentation, but I know we're all living with this COVID situation right now, and of course it's posed challenges for all of you, but for us as well. But we're all in this together. So what we're going to do today is we're going to talk a little bit about how pandemics in general can influence people living with Parkinson's disease, your ability to deal with your medical and healthcare teams, as well as research. And hopefully if we have time for some discussion, we can maybe learn from each other as to what strategies we can come up with to deal with any issues that we're still dealing with. Our contact information is there at the bottom of the screen. You can see MDRC at WLU. We are still checking messages, although we're not technically in the office on a regular basis. So if you do need something, of course, that's the way to get a hold of us. Okay, so I thought I would start with this, and this is a very interesting way of looking at things. So I'm going to show this app. This is something that I created, and what it's going to show us as soon as it runs. Hold on one second. Of course, it's not going to show us, but hold on one second, I can do it. I think hopefully it's opening. Give me just 1 second here.
Technical issues are some of the things we have to deal with during COVID, aren't they, Dr. Almeida?
Yes, of course. Oh, how unfortunate. I had this ready for us to be able to look at. Well, I will at least tell you what it was going to show. Maybe it will open on its own. Oh, there's it opening. Yeah, I think it's coming now. Well, I'm going to continue talking, and if it opens, it opens. What I wanted to show you was an animation, and it's a very interesting animation in the sense that if it does open, which it might be doing right now, it's something that we call the Global Burden of Disease Study. Oh, it is opening. This is great. Okay, so let me just pause this for 1 second. I'm going to explain what we're looking at. Okay, so what you can see on this screen, I'm just going to try and move this aside. Okay, so what you can see on the screen is a tracking from the Global Burden of Disease Study. And what this tracking is starting from January 1st, 2020, all causes of death across the world. This is basically a number of deaths that you're seeing here up across the. So I just lost my slide. Oh, there it is. Okay. So what you can see across the top, you can see different causes of death that are listed. Suicide, you can see, is at the top, malaria, and just take notice that fifth from the top is Parkinson's disease. So what this represents at this point is that on January 1st of this year, there were 941 deaths associated with Parkinson's, and the only categories that are higher than that is homicide, malnutrition, malaria, and suicide. Now, what's going to happen is you're going to see across the bottom of this scale here a progression of dates from January 2nd to January 3rd, all the way up until I was able to get data up until June 22nd, which is just a couple days ago. And what I want you to take notice of is where Parkinson's is on this list, but also the impact of COVID. And as you can see, on January 1st, there were no deaths related to COVID that were confirmed at that point. So let's watch the animation, and I'll try and make some comments as we're going. So as you can see, as the number of days are passing, these numbers are increasing and increasing. And right about here, I'm going to pause on January 23rd. In around this area of January 20th, January 23rd, you can start to see the first signs of COVID deaths. So you can see there's a number 17 showing up on the bottom. And I'm going to press play because at this point, it didn't seem like it was that much of a concern. Obviously, when we look at the top of this graph, and you can see that there's over 40,000 suicides at this point in 2020. Malaria is accounting for almost 40,000 deaths as well. And Parkinson's is already claiming 21,112 lives. But we'll continue with this animation and keep your eyes on the COVID atom for place. This is March 1st. I'm pausing again. So now we're at March 1st, and you can see that COVID is still at the very bottom, second from the bottom. Parkinson's is up here, still in the top 5 causes of death, 57,875. And of course, suicide is much higher than everything else. But over the month of March, you're going to see quite a drastic shift. So follow the COVID one as I press play again. And notice that COVID starts to bump its way up the list, passes terrorism by March 24th, passing fire, hepatitis. And by about April, mid-April, early April, you can see that it's now past Parkinson's disease and homicide. Now into May, we're approaching the suicide numbers. here we are late May, where COVID is claiming more lives than suicide. 22nd of this year, so just a few days ago. Now, of course, there's a few things to take out here, and I'm just going to bump this note of here. The first one is it's pretty astonishing that Parkinson's steadily seems to be in the top 5 causes of death globally. And in fact, malaria is the only disease that is showing a cause of more deaths than Parkinson's. Now, for those of you who have heard me speak before, it is important to keep in mind that generally we say that Parkinson's disease doesn't actually cause you to die, and that is an important distinction. So when we're looking at stats like this and a tracking of the number of deaths related to a disease, what we have to keep in mind is that these types of stats are reporting what disease the person had at death. So this is not necessarily to say that you died because of Parkinson's. I often say in these sorts of talks and discussions that really your lifespan is not going to change as a result of you having Parkinson's. If you were supposed to live until you're 80, you're still going to live with Parkinson's disease up until you're 80, unless, of course, you get run over by a bus or something like that. Okay. The second point here is that as of June 22nd, COVID-related deaths are triple the number of deaths compared to the number associated with Parkinson's. But importantly, Parkinson's is second only to malaria for disease-related deaths. So, you know, the takeaway for me when we look at something like this is that there's got to be some urgency here to try and find cures for things like COVID, of course, infections like malaria, and of course, Parkinson's disease is of critical importance. You don't see any other neurodegenerative diseases on that list at all. So let's address some of the questions that I'm sure some of you are asking or hoping to get an answer from out of this webinar. The first question, of course, is whether there's greater risk of contracting COVID if you have Parkinson's disease. And the basic answer in general is a very echoing no. What we do know, however, is that Parkinson's disease does normally increase per decade of life. And so these are also very recent stats. These are the distribution of COVID cases up until June 21st in Canada. And what you're looking at here across this y-axis is the number of cases in each decade of life. So you can see 19 years or younger, 20 to 29, 30 to 39. And for the most part, you can see a concentration of cases that seems to slightly increase up until the age of 59. And then we have a decrease between the ages of 60 to 69, 70 to 79. And then there's this kind of sudden anomalous peak here for 80 and over. Now, normally, if we were to think of Parkinson's disease, of course, we would say that we should expect these bars to slowly increase and increase because we expect the prevalence of Parkinson's disease to increase per each decade of life, and that's why I like this graph. But as you can see, there's a stunning drop beyond the age of 60, and that tells us that people with Parkinson's and most older adults are actually heeding to the warnings of making sure you try and self-isolate, limiting your contact with others. And there is a general fear that if I contract COVID, that I may die. So we do have this very impressive number, and I think that this drop-off is somewhat related to the fact that between the ages of 60 and 79, people are really taking it seriously that we should avoid any face-to-face contact with other humans if it's at all possible. And we're going to talk about strategies and hopefully have some discussion about what sorts of strategies we could be putting in place to optimize that sort of protection for people with Parkinson's. Now, the other point that we have to address is this line down here below, And of course, as I'm sure some of you realize, once you're over the age of 80, the other concern, of course, is that this number could be biased by the fact that these are also people that are living in nursing homes. As many of you are aware, within Southwestern Ontario, there are several outbreaks in nursing homes that the government has been trying to deal with. But we also have to consider the fact that over the age of 80, there's probably less physical activity, which is something we're going to talk about, which means that if there's less physical activity, there's greater risk of cardiovascular type issues. And hence, if you get any sort of lung infection, you know, the risk of contracting other illnesses is also present. So while we're saying no, the other thing to keep in mind is that as we age, and if we know that as we age there is an increase in Parkinson's disease, then of course people with advanced Parkinson's disease may be at greater risk of complications, in the sense that there may be greater respiratory issues, cardiovascular issues, kidney issues, and some compromise of the immune system. So, of course, this is why we take these extra precautions, trying to avoid unnecessary human contact, limiting the amount of travel. Certainly you don't want to, I've seen some of the lines at Costco, those really aren't the lines that you want to be in. And of course, many of you are aware, and we can discuss this as we get to talk about strategies, that many grocery stores and other types of stores like pharmacies and things like that do have seniors hours early in the morning, so that if you want to be able to get in without running into big crowds of people, that you can take advantage of those times in the morning. Even routine doctor's visits, we are recommending that if you're expecting your yearly physical with your family physician, that you try and avoid that unless it's absolutely necessary for some sort of medical concern. Okay, so some of you may have seen this slide before, but this was published by a group of us last year in Lancet Neurology. And the idea at that point was to focus on this end of Parkinson's, and this is where our research is really focused right now. And as you can see here, we're talking about -15, -10. What that really means is detecting Parkinson's disease before time zero, and time zero is actually where you receive that diagnosis by a neurologist. So the link that we're trying to get across here is this idea that clinical practice has to drive what sorts of things we should be researching. And if we're researching the right things, then we should be able to tell the clinicians what things like unusual arm swing or difficulty doing two tasks at one time might give us these prodromal signals that Parkinson's is on its way. This graph, however, is also very useful for thinking about these end stages and the progression of Parkinson's in the late stages of disease, because of course, when we're at these later stages of the disease after having Parkinson's for 15 to 20 years, then of course we could be suffering from some of these other issues that might pose us at greater risk for contracting COVID as well. So we could think about this vicious cycle, and probably part of this vicious cycle is the idea that in the advanced stages of Parkinson's disease, we end up with physical inactivity. We may be wheelchair bound, we may be limited in what we can do outside, and of course COVID is contributing to this, because we're asking people to try and remain inside. Well, at least not remain inside, but reduce the amount of contact they're having with others. I suppose it's important for me to reinforce the idea that if we're going to exercise or to be in any close proximity of people, it's better to be outside than inside, so that any potential of getting disease is diluted by the air surrounding you. But what we're trying to get at here is this idea that physical activity or inactivity has the potential to worsen the symptoms of Parkinson's disease, and that feeds this Parkinson's circle on the right-hand side. But at the same time, and linked to COVID at this point, we can think about the idea of lack of physical activity as we age, and perhaps if we're sitting on the couch a little bit more and not getting outside as much, gaining some weight. I've probably gained more weight than I'd like to admit right now, working from home most of the time myself. Cardiovascular disease, hyperlipidemia, late onset diabetes, which is linked to a higher risk of COVID-19 as well. All of these things are a vicious circle that can also be fed from this lack of physical inactivity. So certainly something to think about, and whether or not we can actually stop that cycle. Let's get more into the meat of whether or not we should expect motor symptoms and non-motor symptoms to worsen with Parkinson's. And I'll just remind you, as we were talking earlier at the introduction, if you do have questions, please write them down, or you can already start sending them on the chat, and the moderator will make sure that we try and address all of them by the time our time is up for today. So let's first start with this question of can COVID make your Parkinson's motor symptoms worse? And of course, we're talking about things like slowness of movement, your balance, the stiffness or rigidity that most people with Parkinson's deal with, tremor, those sorts of things. And unfortunately, of course, when we have a new disease like COVID-19, we don't necessarily know all of the answers as of yet. So that's the general answer. But at the same time, we do know that, and many of you I'm sure will attest to this, that generally speaking, when you have some sort of infection, there is a temporary worsening of your symptoms. And I put that word temporary in quotes because, you know, if you're admitted to hospital and you're in the hospital for 4 or 6 weeks or longer, then the effect on the symptoms can actually last for quite a while in terms of the worsening of Parkinson's symptoms. But if we think in general about what happens to Parkinson's with flu, urinary tract infections, even a bout of pneumonia, something like that, in all of those cases, we end up seeing increased movement symptoms. In addition to increased movement symptoms, the typical symptoms of Parkinson's, there are well-documented effects on the lack of the effectiveness of medications. And so when we're talking about medications, we could be talking about motor fluctuations, meaning that sometimes your meds are working and in other cases, they seem to suddenly stop working. And there may be more off times. And what I mean by off times is as you approach the next time that you're supposed to be taking your dopamine pills, you may notice that the pills start or stop working, I guess, a little earlier than they should be. And that may be compacted right now by the fact that we're also, all of us are using generic apolivacarb rather than the Cinemet that we used to get until that shortage is dealt with. The other thing to keep in mind, however, is that, you know, when you start to see symptoms, and of course you want to be careful that if you start to see symptoms of something that seems like cold or flu, cough, runny nose, difficulty breathing, you know, most places, most healthcare facilities will say, try and stay home and treat it as you would a normal cold or flu. The only caution here is that I would encourage you to speak to your physician or pharmacist over the phone or by video, because some of the cold and flu medications do interact with some of the medications with Parkinson's, and that's important to be aware of. Specifically, I'm referring to the ones for you know, potential neuroprotection, things like Azilect, or rasagiline is the other name for it, selegiline, those types of drugs, monoamine oxidase inhibitors. They do sometimes have interactions with some of the cold and flu medications, so certainly make sure that you speak to your physician or pharmacist before taking any of those types of meds, just to be on the safe side.
Dr. Almeida, we do have a question, if you don't mind.
Yes.
One of our participants asked, can lockdown and the lack of social interaction lead to an increase in Parkinson's symptoms during COVID?
Can I ask you a favor? Would you mind typing that to me as well? Just because the speaker thing, as I mentioned before, is.
Sorry, just give me a.
No problem. That'll give other people some time to think about what things they might want to ask as well. And of course, feel free to type in the chat section if you can see it there. Click on the chat button. You can type in whatever you want, and it'll be sent over to us to be able to answer. Okay, can lockdown and lack of social interaction lead to increase of Parkinson's symptoms? Yeah, so this is what I was saying earlier, you know, the issue, and I'm just going to back up for one second because it is a very important point. So this is what, in fact, what I was saying here. When, you know, we could think of physical inactivity, the fact that you're choosing not to be physically active. But at the same time, when you're in lockdown, yes, absolutely, this cycle starts to feed as well. So the likelihood of more slowness, the fact that you're not using your muscles as much, the lack of physical activity, the lack of challenging your balance because you're not outside doing the things that you would normally be doing, all of those things have the potential to increase the symptoms of Parkinson's. And as I mentioned, at the same time, we also have these issues on this side that, you know, if we're at weaker cardiovascular capacity, we run the risk of being more susceptible to things like COVID as well. So while we don't know exactly, what I would most liken it to is think of what you feel like when you have a pneumonia or a flu or a cold, what happens to your Parkinson's symptoms. That's exactly what we would expect if you had COVID. And if you're locked down, then I would encourage you to find novel ways to try and keep yourself active. The other piece of this, however, and this is the second piece, and hopefully this answers the question as well, the lockdown has more of an impact on these things. And this is a recent publication from one of my colleagues. This is actually can be found in the Journal of Parkinson's Disease. And this is what we're calling the extra burden of COVID-19 for people with Parkinson's. And there are some pretty serious issues, and I'm just putting them here in bold as well. Social isolation is a huge issue. Not just in the physical sense, but also in the sense that, you know, the inability to interact with other people can certainly be have an impact on motor symptoms, but also non-motor symptoms. So things like anxiety and depression, you know, when you can't get outside, of course, it feels, you know, when you can't enjoy the sunshine, finally we have some nice warm weather. And then, of course, by the time we have the warm weather, it's too hot and we can't bear the heat anymore. But this is an anxious time for lots of people. You know, we're all worried about the spread of this disease. When is this going to end? And staying inside, of course, you have less to do. So sometimes you may notice your spouse, if you're the caregiver, with the lack of motivation, perhaps not wanting to do their daily chores. I even ask my son every once in a while, have you brushed your teeth yet? And he stands up, and at 1 o'clock in the afternoon, he still hasn't changed out of his pajamas. So, you know, we have to be aware of these things because of the fact that when we're in this lockdown sort of situation, it can be depressing. It can be an anxious situation because we're worried of what's going to happen and when it's going to end. And are we going to contract this disease? And, you know, this is wearing another hat, but some of you are aware that we are also doing lots of treatment studies for cognitive and memory impairment as part of the Canadian Consortium for Neurodegeneration. This is a team across the country right now that is focused on this. And COVID, we are finding, is having a tremendous negative impact on people's memory and cognitive function. And this is something to be aware of. If you're children of somebody with Parkinson's, or if you're a caregiver of somebody with Parkinson's, we are astounded to see how this isolation is really leading to some impacts that we didn't realize for cognitive impairment. In fact, we've been running treatments for memory impairment, different sorts of cognitive memory training strategies, exercise rehabilitation for memory. And in the follow-up visits for people who had been in the program over the last 6 months, we're actually quite shocked to see how much they've deteriorated in this time over the 3 months and 6 months of COVID, where people have been in lockdown. So that's something to definitely be in, keep a careful eye out for, and that's why I've started off there. And then the other one, and I think this is something important to mention, because you know, we're all frustrated, and frustration of wondering when this is going to get over leads to more mood fluctuations. I wouldn't be surprised to hear about emotional outbursts, you know, frustration, anger even, because it seems like we've been in lockdown forever. And now, of course, there's talk of a second wave coming where we may be doing this all over again. So this pictorial at the bottom is supposed to represent this triad of things: the added stress, the social isolation, physical inactivity and sitting on the couch too much, and how this can lead in almost like a toilet bowl or downward spiral of lack of cognitive flexibility. And this is why we have to have strategies to try and deal with this. And this is what I'd like to hopefully have some time to discuss at the end of the day. How can we deal with these things instead of letting these non-motor symptoms attack? So most of you know that I'm the exercise guy as well. And so let me just offer a few words of wisdom on exercise before we get to strategies. The first thing, and this is a very simple one, and I tried to handpick these ones because these are the simple types of things that we could all be doing at home. Could exercise help the brain? Of course it could. We might be able to improve memory. There's a proven strategy of trying to learn something new and memorize. Let's say, you know, if you're in my office and I ask you to remember house, tree, and car, if I was to ask you to repeat those words every day in the morning and then again in the evening for 7 days in a row, the chances of you ingraining that into your memory is much higher. Exercise certainly is a treatment for depression and mood enhancement, and as I mentioned before, that can be certainly a concern when we're in this lockdown situation with COVID. In the sense that we release endorphins, we can also improve our pain threshold. So if we're dealing with issues and we're trying to figure out, is there a way that I can avoid going to my doctor's office if I don't need to? And pain is one of the issues that you're dealing with. This is certainly one way of dealing with pain threshold. And then, of course, the one that we focus on most at our Movement Disorders Center is the ability to control and coordinate movement. And yes, I realize we're not actually running our programs the way that we used to, and we're going to talk about what sorts of changes we've made at our center. But something as simple as juggling is an easy way for you to try and control and coordinate movements. So we're at this old adage of use it or lose it. And if you don't use it, would you end up being this guy because you've already lost it? What about on the memory side of things? Is there actual proof this works? And I refer you to one of our most prestigious sources, and this research actually isn't done by our group. This is the Karolinska Institute in Sweden. And if we go to the dementia and Alzheimer's literature, there's this study, one of the largest studies we're aware of 1,500 people with dementia and Alzheimer's that were over the age of 65. And if you're worried about developing cognitive issues on top of your Parkinson's, Well, then this is something certainly important to think about. The idea of tracking, in this study, they tracked people over a 35-year period, so a very longitudinal study. And the result of exercising just 2 times a week decreases the risk of dementia by 50%, so cuts it in half, literally in half, and decreases the risk of Alzheimer's disease by 60%. And that's just twice a week for 20 minutes. So imagine if you're worried about cognitive issues, is this something you could achieve on your own or with your spouse or children? Of course you could. There are other explanations as to why exercise might work, and it sort of depends on whether we're doing mental or physical exercise. There's this idea of the neural pruning hypothesis, which is this idea that, perhaps we keep the connections between the neurons the more that we use them, and the more we use our brain actively to do things that we don't normally do, the more those connections stay intact. You could go with the simple use it or lose it hypothesis, like thinking about what happens to one of your muscles if your arm has been in a cast, for example, for 3 months, and how weak that muscle becomes over time. And the idea of doing simple things. Exercise doesn't always have to be physical. It could be something as simple as doing crossword puzzles or these other types of games and activities that keep people interactive. And if you don't want to do any of these things, certainly with this lockdown issue that we all have right now, ask yourself this: when's the last time you picked up a photo album or a home movie or your grade school notes, if you still have them? Just to go through those things, and one for social interaction, to recall some of those things in the photo albums or home movies, sometimes just to lighten the mood and to remember some of the good times in the past. This would be also considered a great form of exercise. Okay, what about from a neurological standpoint? And I won't spend too much time on this, but this represents, on this y-axis here, the amount of dopamine in the basal ganglia. That's the part of the brain that's affected by Parkinson's. So striatal dopamine here in black is our baseline, because this is a normal person not doing any exercise. And notice that if we add in a healthy person some exercise, that even in a healthy person, we can bring the person up to nearly 100% of their dopamine levels. And I should have explained across the bottom, this is over time. So this is 20 years of age, 45, 65 years of age, and 80. And as you know, as neurons degenerate, of course, we're going to have, even in healthy people, as you approach 80 years of old, you're going to have less dopamine neurons available. But notice how we can change this with exercise. Now let's look at the Parkinson's situation. The Parkinson's situation is here. The red line, you can see that this loss of dopamine neurons is of course accelerated. And by the age of 65, we're already at this overt Parkinson's disease point of view, and we're heading towards this almost plateau of close to no dopamine. The important part to take out of this, though, is that even at diagnosis, adding exercise, and that's what this dark gray line is showing you right here, that is the change in dopamine levels as a result of some sort of physical activity. So that's the important part, because if we were able to start that earlier, perhaps this dotted line is where we could bring somebody with Parkinson's to be before that diagnosis. And this is sort of why we're after that prodromal, or identifying symptoms as early as possible, and trying to convince people to exercise as early as possible. Okay, the last thing that I'd like to talk about, and then hopefully we'll just move into discussion, is the advent of telemedicine and teleresearch. As all of you are aware, physical distancing and limited face-to-face interactions is critical. So our university and our research center is officially shut down, in the sense that we are not bringing anyone on campus to be able to do any sorts of assessments or research at this point. And it's important to reiterate that this is for your own safety as well as the research teams and the healthcare teams, so that we're not spreading this disease any further than it needs to be. Some of the questions, however, is can telemedicine and research deliver the same experience as in person? And I'm sure some of you will have opinions on this. It is certainly tough from a research perspective to be able to do some of the things assessment-wise that we like to do. Medicine-wise, you know, it's tough to know. I know some people have said to me, well, I don't feel like I'm getting the same bang for my buck because I don't even get to see my doctor one-on-one and face-to-face for him to actually understand what I'm going through. Recent research has shown that telemedicine is close to as effective as seeing a patient in person. And research, we're still sort of trying to figure out how this is going to go in terms of how we can deliver things like exercise strategies, but also importantly, and this is the next point on here, is whether the assessment that your neurologist or someone like our research team does, is it equivalent to do it online as we do in person? And some of you know that because our exercise programs at the center had to end abruptly, our completion of programs would have been delivered online over video, and the assessments also would have been delivered online. We even attempted to try and see if we could do something like this. What this is our medical reception window. And what we had proposed to the university is that we do the tests where we can actually see you face to face, but our assessment team is behind this glass, and then the participant in our programs is actually standing outside of the glass. And then, of course, if we needed anything filled out or a blood test or anything like that, then you would stick your hand through the window where you normally pass papers or your health card through. It didn't fly, is what I can tell you, but it's a suggestion that we're working on as we get closer to reopening. Okay, here's one answer to this question. We have made the attempt, because we had to do some of our assessments of Parkinson's symptoms over WebEx and Zoom and those types of programs. We have made an attempt to see if we could predict your actual Parkinson's score and what it would be if I actually saw you, or if your neurologist saw you in person to do the physical assessment that they normally do. And that's the Unified Parkinson's Disease Rating Scale, where we do all that hand tapping and the walking and the balance tests and those sorts of things. And what you can see here is that, in fact, the correlation is actually quite decent. There's a few outliers here where the scores are higher than they should be, but for the most part, you can see that the predicted score that you would have had from getting the in-person assessment is very, very close to what we would expect based on what I would have assessed of a participant in one of our research studies by looking at them online. We've gotten to the point, in fact, that we've actually created a formula where we can input the incomplete online assessment that we've done. Of course, some of the things that we need to do involves me putting my hands physically on your limbs to be able to feel rigidity, for example, to be able to do balance tests where I'm pulling you backwards and things like that. Even with that incomplete score, we are able to use this formula to predict what your overall score would be. Okay, so my last point here, so that we can get on to discussion, is to try and think about what things we could do to optimize your interaction with your healthcare team or your research team, but most importantly, your healthcare team. One, I would say, try and make a list of key questions, the things that you want answered before the end of your phone call or your video call with your physician or your healthcare team. I would also suggest making a list of new issues or concerns. And if it's things like timing of your meds, it's important to make note of when you're noticing dyskinesia, what time those dyskinesias happen to start. Also to make note of what times, if there's patterns as to when the medications are stopping working, or if there's sudden off periods that are unpredictable related to what time you actually take your medications. I would also recommend that if you're going to see your physician, that you ask for a stock up on your prescriptions. There are many pharmacies now, and the government's allowing this, allowing you to be able to take more than what you would normally take of your Cinemed or of your other Parkinson's prescriptions, so that you don't have to make multiple trips every 3 months or 6 months to get to the pharmacy and pick up a new prescription. So take advantage of that. Certainly don't show up at your doctor's office without an appointment. And in fact, if you have concerns about having COVID, these 2 links, which we're going to share with you, are a way to try and figure out if you should take this more seriously. So the one is a tool here called a self-assessment tool, and all you have to do is click on the link and you answer the questions. If you answer yes to a certain number of questions, then it actually gives you some recommendations as to what you should do and who you should contact. And then, of course, our government is asking you to consider getting tested. So if you're trying to figure out where to get tested near you, this is a simple way of doing it. All you have to do is click on this link, and it's a public health unit locator. And then when your region's public health unit opens up, all you have to do is type in the word COVID testing in the search, and it'll pop up with a number of locations that are nearby to yourself to be able to get that test done. Okay, finally, these are strategies. And I'm hoping other people will have comments and strategies that they would like to share with the group. Number 1, stay connected. Stay connected with family and friends. There's lots of free computer platforms like Zoom, Microsoft Teams, WebEx, Skype. I'm sure there's other ones. Consider having your groceries delivered. Take advantage of your children. Remind them that you change their diapers, and tell them that you need them to drop off some groceries for you every once in a while, or there's also delivery services that can be taken advantage of. Social distancing and social barriers. You saw the idea of a medical reception window. That's easily your screen door in your house as well. If your children want to visit and you want to keep in contact with them or to see your grandchildren, do it through the doors so that you're still able to see them and still interact and keep that social interaction alive, but with a safe distance. Wear a mask and gloves when you can. Stock up on your prescriptions. And lastly, get in touch with PSSO. They're the people that organized this call today, and they really are there to help you. So there's their website and there's their phone number. And I think my last comment is just you. It's always better to be safe than sorry. Even this person right here is making sure that they're safe. We should all take that advice. And I'll end with this one. Usually I end this to talk about Parkinson's, but Michael J. Fox once said, "I don't have any choice whether or not I have Parkinson's, but surrounding that non-choice is a million other choices that I can make." And this really does apply not just to Parkinson's, it also applies to COVID and whether you want to put yourself at risk of contracting this disease as well. You also need to make those choices as to whether you want to be physically active or not active, and that's hopefully what we can talk about. So I'm going to stop there. There's my strategy list, and if anyone has any comments or strategies that they'd like to offer, any questions, we're happy to continue discussion from here.
Thank you, Dr. Almeida. Actually, I did put through another question to you on the chat, if you can take a look at that one. And then I had a question about the mask and gloves. Is there a preference to the disposable masks versus the rewearable masks?
Yes, that is a good question. Yes, and I do also see, thanks Mark, I do see the other question on there as well. So I'll just address the mask one first. So, you've seen a lot of things on the news about whether homemade masks are the same as, the medical grade masks. And let me start by saying any protection that's covering your face, even if it was a sock, is better than no protection at all. Is it the best way to deal with it? No, but when we're dealing with masks, there's a couple of important things to keep in mind. One, as I said, any barrier is better than no barrier. Number two, when you have a mask, it is important to remember that if you have that mask on, you need to avoid touching the front of the mask, because you have to imagine every time you're inhaling through that mask, whatever germs are on the surface of that mask, if you go and adjust the mask, you've now just put that on your hands. And one of the most common places to contract COVID is from the hands when they go and rub on your face, your eyes, your tongue, because you're eating something. So certainly try and avoid touching the mask. And when you're done with that mask, it should be washed, or if it's a disposable mask, definitely throw it out so that it's not anywhere that anyone else is going to be touching it either. The other question on here is, are there any computer apps that you would recommend for physical, mental exercising? Aha. Okay, so, there are a number of, that's a really good question. So some of you are aware that we are already on the cusp of trying to figure out how to deliver exercise strategies online. Our PD SafeX program and Rock Steady Boxing, we've been experimenting. One of our graduate students, in fact, the one who created the graph with the correlations predicting the ability to predict your symptoms from an online assessment. Her name is Kishri Sangorapillai, and one of her attempts right now is to see if she can deliver some of our programs online. Could you find other programs online? Yes, there's, Instagram. If you're on Instagram, there's even just to look up Beat PD today. Beat is B-E-A-T, PD as in Parkinson's disease today, all is one word. There are definitely videos that you can partake in on there, even to go on YouTube and type in Parkinson's, exercise. Some of those strategies where you can watch something and do it within the comfort of your own home is certainly better than nothing until we've figured out some better strategies.
Okay. At this point, we're still open to questions. Those were the questions we had, but if anybody would like to ask Dr. Almeida a question, please put it in the question panel.
And by all means, if you come up with strategies of your own to keep active, or if you know of any other websites that are good, please send them along so that we can share it with the group. If you've thought of other strategies as to how you can stay socially connected yet safe, we would love to hear them.
Yeah, we definitely have a range, of folks that are still in stage 1 down in our Windsor-Essex chapter or Windsor-Essex area, all the way up to, our rural chapters who have no cases or very limited cases in their communities. So it's quite a difference that our clients are facing right now.
Yeah,
we do.
As we're waiting for questions, I guess I should say, we talk about telemedicine and tele-research as if it's something new. And to be fair, we've been doing this for a very long time. Some of you, I'm sure already, before all of COVID, were already having some of your assessments and follow-ups with your neurologist online. And we do the very same thing. We've conducted assessments in Collingwood and Owen Sound through computer like WebEx and Zoom. So is this new? No, we've been doing this for a long time. Is it something to get used to? I think this is something that we may be dealing with for a very long time. So, if you don't have a computer, well, you probably have a computer if you can hear me right now. But if you're listening with a son or daughter or a family member right now to be involved in this call, certainly this would be a good time to invest in a computer or even a tablet or something smaller so that you have the ability to do this, because probably for the duration, we will have a lot more online assessments and online medical appointments than we've ever had in the past.
Absolutely. A couple more questions have come through, Dr. Almeida.
Okay, I see. Has there been any research regarding cannabis oils? Gosh, that's a question that keeps on coming back. You know, everybody wants a prescription for marijuana. So this is a tough question because there is research that is out there. Cannabis oil has, in many ways, can reduce levels of anxiety. So we have to think about motor symptoms of Parkinson's, and we have to think about non-motor symptoms of Parkinson's. So on the motor side of things, what we have to keep in mind is that cannabis has the effect of slowing you down in general. Parkinson's also has the effect of slowing you down. So would it help with symptoms like that to have a medicinal prescription from your doctor? Probably not. However, at the same time, the oils themselves have been proven effective to be beneficial for pain. So if you're suffering from pain related to rigidity, or because you have dyskinesias that are not controlled, if they're not controlled, probably you should be talking to your neurologist in the first place. But as a strategy for those times where they are uncontrollable and potentially painful, even dystonia as a side effect of medications, this is where the oils may actually be of great use.
Okay, and there was also a question about, for those who have lost ground during lockdown, can it be reversed?
Oh, I'm sorry, I missed one there. Yeah, can it be reversed? That is a really good question. You know, Mark mentioned earlier that PSSO was actively recruiting to organize their conference for October. I will be able to give you a very good answer to that by October. I can tell you that our group has been focused on doing long-term exercise interventions. Some of you may have even been involved, but we've had an exercise study that's been going on where people are continuously involved in our programs for 40 weeks. And part of the issue is for us to try and figure out what does that mean in terms of those who were in the midst of a program and then all of a sudden got locked down. And we've just finished assessing some of those people. Others will be finishing assessing within the next 2 or 3 months. So by the time October rolls around, we'll have an answer. My gut impression is doing something is better than doing nothing until we can see you in person.
Excellent. Dr. Almeida, thank you so much for your time. This is the first time I've been able to interact with you, and I can't wait to see you and meet you and hear you again in October at our virtual conference, which we will be posting some information about on the Parkinson's Society website very soon. In the meantime, a couple quick advertisements before we thank Dr. Almeida. If you haven't heard already, we have a fun thing to go along with our new Walk the Block for this year, where we're asking everybody to do a brain freeze challenge. So there's information on the Walk the Block website for this year, and it's gonna be a lot of fun. You get your favorite ice cream or your favorite cold treat and tape yourself getting your brain freeze, and you know, it's all relating to your motor gait and to your mobility. And we're hoping to encourage other people to join in and have some fun and make a few donations to help out Parkinson's Society and the programs we do. We also have a coffee clatch starting on Tuesdays during the summer, and that will not replace but certainly augment our support groups. So if you'd like to join us, again, go to parkinsonsociety.ca. Information will be coming up, and it'll be every Tuesday morning, I believe, at 10 a.m. From everybody from Southwestern Ontario is invited to join and share their experiences and their questions and help others that are new to Parkinson's or may have had it for quite a while. So all of those exciting things coming up, in addition to our pre-Canada Day concert next Tuesday. We're keeping you busy. We're trying to keep everyone motivated during this time. And Dr. Almeida, your talk just helped us all I mean, we've all been struggling. It's a tough time. You know, those with Parkinson's really have to be careful with around COVID and in their communities. And I want to take the time to say on behalf of everyone who's attended, you know, thank you for doing the research, for helping us disseminate it out, and for calming some of the fear that happens to be out there around, you know, COVID and Parkinson's. It helps us take a step back and realize, you know, that we're all in this together, and there are resources and there are people like yourself out there that are making sure that those with Parkinson's are taken care of. So thank you for your time and for answering the questions today.
You're welcome. We're certainly in this all together, and I will just advise those of you that are on the call, keep active. And I've heard that I've been challenged already to the brain freeze challenge tomorrow. So I bet if you look at the Parkinson's Society website, the site that you can see on your screen right now, probably within the next couple of days, you'll see me partaking in that challenge, and hopefully you'll join us as well.
I think your kids should join it as well.
See you in October.
All right. Thanks, Dr. Almeida. Thank you, everyone, for joining us. Be safe, be careful, and have a great day.